This is a call to a nurse coming from a far-flung area in Rwanda. The patient is using a chatbot-based system to diagnose their symptoms. And the nurse is finding out whether the case is urgent and what to do. This technology allows patients to book doctor's appointments, pick up prescriptions and access their medical records using an app. But in a country where most people don't have smartphones, the solution lies in old-fashioned way, by placing a call.
Between 80 to 90% of our clients are actually calling us from rural areas. This product matters the most to people who do not have access, and those are people living in rural areas.
Hey, I felt bad in my stomach when I finished my food.
It's people like Nadine Muneziro who use this service frequently. After a quick phone consultation, she is headed to Kagugu Health Center on the outskirts of the capital, Kigali. She also uses her smartphone to pick up a prescription at the health center.
There's an advantage to having a consultation with Babel. You don't pay all the charges because you use the phone to be treated. And then you don't waste hours in a queue like these patients. You come and pick up the medicine and get back to your business.
A typical consultation costs about 200 Rwandan francs or 20 US cents. It's heavily subsidized by the Rwandan government and some NGOs. The doctor-to-patient ratio in Rwanda is one of the lowest in the world, and the technology is aiming to bridge that gap. Babel Health claims that over 30% of Rwandans eligible for the service have registered since its launch 2 years ago. But critics say the service cannot replace the same level of care as humans.
We are not in the business of replacing doctors. We are in the business of augmenting them, augmenting their capability and improving what they've been doing.
With the digital service reaching millions, it might be one example of what technology can achieve for the greater good in health. Akanksha SAXENA, TRT World.